Hello, this is Tony Burkhalter, and I'm here to introduce you to some important topics in Chapter 10, which allow for the analysis of exercise and sports movements. In past chapters, we've taken a look at the fundamental types of movement, such as walking and running. In this chapter, we're going to analyze different types of exercises. Being able to identify which joints are moving, how they're moving, and which muscles cause those movements is extremely important to understand in human movement. Let's take a look at different exercises to determine what action the joint is performing and the principal muscles used. We can look at one upper body exercise and one lower body exercise. For our upper body exercise, we chose the seated front barbell press. You're seated during this exercise, and the concentric phase occurs when you press the bar up, starting from your chest to overhead. The movements of the seated front barbell press are shoulder abduction, elbow extension, and shoulder girdle upward rotation. As a reminder, abduction is the movement of a limb away from the midline of the body. The middle deltoid, the anterior deltoid, and the supraspinatus, which is part of the rotator cuff, are primarily responsible for shoulder abduction. Another reminder, extension in a joint always increases the angle of that joint, and the primary elbow extensors are the triceps brachii. The shoulder girdle, including the scapula, rotates upward with the help of the trapezius and serratus anterior. So now that we've done the upper body exercise, let's look at the lower body exercise. For the lower body exercise, we're going to review the squat. The squat is a whole body exercise and differs from many other exercises. If you drop a pen on the ground, you can pick that pen up while keeping your back upright if you use a squat. A squat is different than many other exercises as it begins with the descent or down phase and ends with the ascent or up phase, bringing you back to the standing position. The action of the joints during the ascent or up phase of the squat are hip extension, knee extension, and plantar flexion. The hip extensors include our gluteus maximus and our hamstring group on the posterior side of the upper leg. The knee extensors are the quadriceps group, which include the vastus lateralis, vastus intermedius, vastus medialis, and the rectus femoris. The two exercises we chose to highlight target large groups of muscles, but if you vary the technique and add more focus on a particular muscle or muscle group to promote muscle growth in that area, you'll see lots of benefits. For example, when working the upper body, you can vary the position of the forearm. With the squat, you can either have a narrow or a wide stance. Being able to recognize what muscles are being used during major lifts is important. If you repeatedly take advantage of the same action from the same joints using the same exercises, it can cause overuse in those areas and injury. Being able to vary what muscles are being used during the workout is not only important for preventing overuse injuries, but also allows you to more effectively build muscle and strength in a uniform manner throughout the body. Also, adding variation to lifts can help you reduce everyday injury and spice up your workout. Thanks again for your time to learn a little bit more about how our bodies move.